Risk factors for Alzheimer's disease. Because it's the #1 cause of dementia, we're going to focus on that and extrapolate a little bit, but lots of them. Now, we're going to divide these up into modifiable and non-modifiable risk factors. Okay, so a modifiable risk factor is just that. It's something you can do something about. But a non-modifiable is, well, something that you can't do anything about. So you might guess you can't go back in age, so that one we can check off the list. Your genetic makeup. We don't have a way of changing it at this point that's readily available. Down syndrome is also a high risk for Alzheimer's disease. And the female gender. So these are things that we can't do a whole lot about. But other things, such as head injury, anemia, cerebrovascular risk factors such as hypertension or high blood pressure, diabetes, smoking, obesity, and even some medications can contribute to your risk of developing Alzheimer's disease / dementia. So these are the things that we're going to focus on today. Now I'm going to start throwing up some percentages. These percentages are what we call PAFs, or percentage attributable factor. So what it means is, when I throw up a percentage, if you were to take out that risk factor, in this case gender, age, and genetics, that's the percentage of people with Alzheimer's, with dementia, that wouldn't have dementia anymore. So another way of saying it is, if we could take out these people with a certain gene, we could decrease the prevalence by 7%. Okay? So what I'm referring to here, and this is non-modifiable again, but is the ApoE4 allele. So if you've read much about Alzheimer's disease, you've probably seen it written somewhere, ApoE4. ApoE4 is one variant of a gene that increases a person's risk for Alzheimer's disease. But we can't do anything about that. So let's not waste a whole lot of time on that. Let's get to some modifiable risk factors. The good news is there are a lot of them, and so we're going to dig into quite a few of them. I'm going to divide them up into early life, middle life, and late life. Early life, less education, has a PAF of 8%. All right? Now, what does less education mean? In this particular study, they found that individuals with no school or primary school only were associated with a 1.6 times increased risk of developing dementia. But it's unclear if after secondary school, if going to school beyond secondary level is protective. So we don't know that yet. We've just found some associations with lower level of education. And this really underscores a concept that I want you to walk away understanding at least as much as we do, which is not a whole lot, to be honest. But it's a concept called cognitive reserve. All right? Everybody has a cognitive reserve. It's different for everybody, and we don't fully understand what contributes to that cognitive reserve, but what it essentially is the difference between when you have pathology or a disease that's present, the time when that occurs, to the time when you start to develop symptoms, okay? So another way of thinking about it is, if you think of a reservoir that's filled with so much water, so it's filled up to here, and everything's good, no one's going to go thirsty until the water level gets down to here. Well, for you, that difference may be from here to here, but maybe for your friend, that difference is a little bit less. So it's that cognitive reserve, which we don't fully understand all the factors that go into it, but it's that cognitive reserve that's a really interesting point that researchers are looking into, because since it's different for everybody, and those with a greater cognitive reserve show a bit more resilience in resilience from developing symptoms, maybe there's something about cognitive reserve that we could learn to help other people increase their cognitive reserve.